The push for Canada to develop a national autism strategy is taking another leap forward. A report released Tuesday outlines the structural and systemic gaps facing people with autism and their families. Dr. Lonnie Zwagenbaum, the chair of the oversight panel that produced the paper, says a national strategy would provide a central vision in addressing social and economic barriers for people with autism, as well as their families and caregivers. Much of the study is also dedicated to highlighting the need to understand more about autism among Indigenous peoples. Well, joining us now to talk more on this is Dr. Isabel Smith, autism expert and professor in Dalhousie University's Department of Developmental Pediatrics. Dr. Smith, welcome to Forum Daily.
Thank you very much. Thank you for having me.
So what are the structural and systemic gaps facing people with autism and their families in Canada?
I think a big one overall is the lack of recognition of the diversity of strengths and needs among autistic people. Autism is a spectrum itself, aligned with different levels of ability and disability. And then that intersects and overlaps with all the other sources of diversity among us all, gender, race, culture, all of those things. So we're talking about a large population with very diverse needs, and we're falling short. So that's a big one. I think another really big gap is in the disparity in access to services across the country. So, depending on where you live in Canada, you might have access to really quite different services if you're an autistic person or a family member of an autistic person. And I think that's something we really need to address.
All right, Doctor, let's talk solutions. What are these key recommendations from this report in terms of addressing these gaps here?
Well, I think there are recommendations around a number of areas. I think in general, increasing acceptance and understanding of autism and needs of autistic people through, concrete actions like increasing access to supports, funding sources for, various needed services. A huge need for capacity building in our healthcare system in particular, both to address diagnostic needs, on very long waiting lists for diagnosis, and access to mental health supports, because there are distinct mental health needs that are common among autistic people. Another key recommendation is really to increase the focus on autistic adults, because many of us, when we think about autism, think of children, think of the needs of autistic children, and that's where a lot of our services lie. Even those, we have disparities across the country, but when it comes to autistic adults, we really, people really fall off the cliff. We really don't have the kind of systematic support supports that are needed for this growing population.
It's clear there are a lot of diverse needs when it comes to people with autism. Now, the study also highlights the need to learn more about Indigenous people who have autism. So what do we know so far about their unique needs?
Well, that's the thing. We know very little, but this is a big step, because this report really went out of its way, the framers of the report, to engage Indigenous autistic people and their supporters, family members, and so on. So I think what we've learned is that the big thing is that all of the challenges that are faced by other autistic citizens are amplified for Indigenous Canadian autistic citizens, because they're again, that intersection with, the disadvantages that are often faced by those groups. For example, even feeling comfortable approaching the healthcare system if you've previously encountered stigma in that arena. So I think it's, we're just starting to learn. We're learning with Indigenous autistic people, and I think we've got a long way to go.
A lot of research to be done. Now, we've got about 45 seconds left here, but many families have been calling for support for years when it comes to autism. So how close is Canada to developing this national autism strategy?
We're a huge step closer now that we've got this report, because this is a first step that brought together, a huge number of voices from across the country, from all kinds of communities, from families, autistic people, researchers, clinicians, policy people. So that's a step that will allow us to now start building what are the supports that are needed. these recommendations that have been made are a first step. And then we need to enact these recommendations, to make active changes that address the needs of autistic people. But now we have a way to get there because we've identified what some of the issues are.
All right, Dr. Smith, thank you again for joining us today on Forum Daily.
Thank you.